Hello, I'm talking about Minieres disease today. So usually the symptoms they're talking about is room is spinning, they have nystagmus, they have tinnitus, they're hard of hearing, usually on unilateral side mostly than the bilateral side. Um, and they are age group of 40 to 60 years old that have this. And it is the room spinning and all these symptoms. Minieres is only ruled out only after everything else has been checked out. It is the last thing. Usually with labyrinthine neuritis or vestibular or neuroneuritis. I lost the words now. Labyrinthitis and vestibular neuritis, they usually check for, Epstein-Barr, shingles, herpes simplex. Even COVID had symptoms of shingles, so I do recommend checking that also out for people. With the cold also, with the sinus infections and everything gets pushed into the ear area, unfortunately. Like I said, we have a lot of important nerves and very important structures that are right next to each other. Our breathing, the cold that we get, the sinus infections that we get, the inner ear that's here, that starts from here, is all so connected and so close to each other. So low sodium diet, as always, staying away from caffeine, go caffeine free. It really does work. Decaf always works for me. No alcohol till you figure out what is going on. I didn't say stop alcohol, I just said till we figure out how to get you out of that position and get you more hydrated. Usually my recommendations for pelvic health patients is, if you are having more hydration, you can have your cup of coffee. Because personally, I would never be able to stop my coffee drinking. I knew that for a fact. So I accommodated it so I could have my 1 cup of coffee that I had. So because I did that huge change, the fatigue level really went down in me, because I do need coffee when I'm exhausted. So I'm sure the people who are having, all this throwing up and nausea and dizziness are getting tired. Now, the major signature about Meniere's disease is they are complaining of dizziness, not just for like 2 hours. It's continuously there for like more than, a couple of days. When it's more than like 20 hours, that you should report it continuously. You're lying down and you're continuously dizzy. You're sitting up and you're doing nothing and you're dizzy. The doctor needs to know how your symptoms are so they can rule out other stuff. But you have to be strict about the diet. Check out for allergies, because some of those triggers are like gluten, dairy. We don't even realize it. We are pushers. We try to strive for success. We're human beings, of course. So we are going to push through all the barriers we can think of, even though our body's responding with an immune, like, I don't want that. And we are not listening to it, because we know psychologically we have to get through that barrier to make life easy on us. But so try to find out the trigger, try to reduce it. Okay. So usually what the doctors try to help the patient with is, like I said, my favorite stock word, meclizine. Find the companies that make meclizine, buy the stocks. I'm telling you, everybody's on meclizine now. And diazepam. They do give for prochlorazepine also. A number 1 favorite diuretic to reduce the endolymph in the inner ear. What they give is hydrochlorothiazide and acetazolamide. Everybody doesn't need it. It's just 1 or 2. Sometimes it's just temporarily given to relieve the pressure, not meant for every day. So make sure you're connecting with your doctor. Do I take it before symptoms? Do I take it after the symptoms are resolved? So you know how the medications work. If you have seen my other YouTube videos, you know all these medications have a half-life and they have an effect on other medicines. So the pharmacist has to make sure that other medications are interacting safely with these medicines, okay? Sometimes they're given steroids for calming down the whole, this whole area, so that it doesn't send more fluids there. It's intramuscular sometimes. It's transtympanic, or sometimes it's an oral antihistamine. But the medications are given, make sure you guys take it though, okay? I had patients who said to me, oh, I didn't take this because I don't think I need it right now. And I'm like, you're still dizzy. We can't figure out whether it is because you didn't take the medicine, you took the medicine. Go talk to the doctor and tell them what you're doing so they know what to expect from it. Some patients do take injections, gentamicin in the intratympanic area, and it seems to help. So how do I cheat the system? I give, for physical therapy, I give exercises. I like to compensate for Minieres by using your oculomotor nerve, the trochlear nerve, and the abducens nerve to work on rotation, your tracking, your visual cues so that the eyes will take over, because if your visual is more accurate, it helps out. A very important rule, if you're wearing bifocals and then you're moving to trifocals, your dizziness is going to increase. So try to make sure you are aware when you're changing your glasses. I had patients who were on trifocals who took their glasses off completely and went to 2 glasses, one for driving and one for reading. And falls have reduced, because with Minieres, you don't want to take a chance. If you know your house and you can't see the ground and you're feeling dizzy, you're definitely going to fall. So try to make sure everything is set up in a way, So I will be working on single limb standing, balance activities. Because of steroids and the gentamicin and all that stuff, muscles are getting weak. In general, the otoliths come out even if you take antibiotics for the teeth. That is a very normal, common fact. But there is compensation. You have to drink water, and we tell you guys every day to walk. Walking 2 hours is such an important thing to get the fluid moving. Even Tai Chi is a very good strengthening program. It helps the proximal muscle strengthening. So I always recommend patients to practice Tai Chi and go for walks. The ENT might send you to an audiologist to try the warm cool air convection. It kind of sees how your your inner ear is working with the cold air and the hot air coming in under 2 different sides. They'll do a video nystagmography. Frank Wilson's lenses are also what PTs use sometimes to work the nystagmus usually. And the hearing test is done specifically by the audiologist or the ENT doctors. They can help you out. In general, I do tell people, check your biome, because when you're on all these antibiotics and all that stuff, if your biome is damaged in your chi, it affects your whole inner body. Your balance is gone because of the all these medications. So you can change that if you're correcting your GI issues. Go vegetarian, take the anti-inflammatory out, ask your doctor what is an anti-inflammatory medication to take. Avoid gluten and dairy stuff for a while, change it to gluten-free or dairy-free products, and see if that makes a difference to the otolith and the endolymphs. Once you get back to normal being, that you're able to lie down and you're not dizzy, you're standing up and you're not dizzy consistently, then you are able to go for more things, okay? PT will continue to work on hand-eye coordination, single limb stand, muscle tones, coordination, and proprioception. Such an important thing. Alrighty guys, thank you for listening. I will put all the exercises that I recommend patients to do in the next ones, okay? Alrighty. It doesn't matter. So whether they are, Minieres, labyrinthitis, or neuronitis, we work on them all regardless. But I specifically tell patients who is supposed to do an epi, who is not supposed to do an epi. There is a difference. I am watching, I'm observing how nasal you are, how your sinuses are reacting. I am listening to the head thrust. I'm watching where the cells are going that day specifically. I had patients who went to the ENT, then they came back to me, they saw something on YouTube and they tried it, and then after that they were having a different symptom. So because I knew what they were doing, I was able to put them back into BBB position and then resolve it from there to disc sulfite. But all people cannot do that. Have someone else do it for you. You have enough. When your world is spinning, frontal, sagittal, transverse, in all these directions, it is extra work to figure out where it's going on. So take the help you can from the ENTs, the physical therapists, let them help you out, or PTAs who are certified like I am. So, all right. Have a wonderful day. I'll put my exercises in next.